In this video, I'm going to walk you through a 3D running gait analysis of a runner dealing with patellofemoral pain syndrome, also called runner's knee. My name is Dr. Kevin Vandy. I'm a specialized physical therapist that focuses on working with runners, overcoming injury, and to improve performance. We're here inside my Gait lab in San Jose, and I'm going to walk you through an actual runner who's dealing with runner's knee so you can get an idea of exactly the biomechanics, the movements in running that are risk factors for runner's knee. Again, it's one of the most common running injuries we treat and we see. It affects the most amount of runners per year in terms of injury, and the best part is you can get out of it quickly. You can check out my other videos on runner's knee that walk you through the exercises on how to treat it, but this video is all about why it happens from a running mechanics perspective. So let's dive right in. In this video, you're looking at a 3D running gait analysis with video here from the back view and this skeleton, which is a composite of this runner's mechanics, his joint angles. So what I'm going to do is I'm going to pause this video at some key points in the running gait cycle. The first point I'm going to pause it at is right at initial contact, or first point of contact with the treadmill here. And I'm just going to go a frame or two from that. And what you'll see here is this runner already has a curve in his spine due to his pelvis, this bone, starting to drop on the left side, which is the side opposite of his stance leg. This is commonly seen in runners with runner's knee, that the core, the back muscles, the abdominal muscles, and the front abdominal muscles aren't functioning correctly to stabilize the pelvis with the pelvic muscles. And this creates a mismatch between the rotation of the rotation and side bend of the upper trunk and the rotation and bending of the pelvis. So already this runner is put in a position where it's in a non-ideal state to accept load onto the leg. As this runner continues to load his right leg into what we call midstance, or the point where both knees are about at the same point, or the highest point of force or pressure in the running gait, this is where we see some form changes very common in runners with runner's knee and other ailments for that fact. So you see that the side bend, the trunk here is off to the right-hand side, and you can see it here in the skeleton avatar that the trunk is shifted right compared to the pelvis. You also see that the pelvis, this structure here, is tilted down and to the left. As you see here, the right side is higher than the left side. When this happens, the muscles in your gluteus maximus and gluteus medius, these side muscles here, they're not doing their job to pull on the pelvis and keep it level. So when that happens, if I move this image to the front, when that happens, what you'll see, in order to compensate for the trunk lean to the side and the pelvic drop, the knee will come inwards towards the midline of the body. When that happens, you can see there becomes a mismatch between the kneecap and this thigh bone. This mismatch creates an area of very high pressure underneath the kneecap. You can see here that the kneecap is shifted, and when it shifts, that increases the pressure under the kneecap, causing pain. But it's not the kneecap that was the problem. What was the problem is what's happening in the trunk, the destabilization of the back and abdominal muscles, your intra-abdominal cavity, the lack of control of the gluteus medius and maximus muscles, these butt muscles to control the pelvis. These two structures, when they're off balance, create the need for the knee to roll inwards to stabilize the body. That is the cause of runner's knee. So it's not so much about taping the kneecap, and it's not so much about wearing a knee brace. That's treating the symptoms and not the cause. The real fix for treating runner's knee is controlling pelvic drop, controlling excessive trunk rotation, through the activation of your gluteus muscles, and through core work in running specific actions. So as a runner, you relearn how to stabilize the central part of your body, which will stabilize the lower part of your body. So again, that is a breakdown of running gait, three-dimensional running gait of a runner with runner's knee. As you can see, there's a few pieces there that can be addressed with rehab, targeted rehab, that works on your butt muscles, your glutes, works on your core, your abdominal and back muscles. And most importantly, doing single leg running specific work to work on your alignment and work on the control of your body. Again, you can check out the other videos I have here on the screen. These videos I recorded are how you treat runner's knee with some targeted running specific exercises. Be sure to check that out. Guys, if you found this video helpful, I'd love if you hit like, subscribe, and be sure to hit the notification bell so you can see future videos of mine. If you yourself have runner's knee, feel free to drop a comment. Let me know what questions you have. I answer all of them, and I'd be glad to help you. As always, guys, continue to train smarter and perform better.